similar to physical problems. Encourage slow, deep breaths. Obsessive-compulsive disorder is characterized by obsessions, which are recurring persistent thoughts and compulsions, during which the client feels a need to perform repetitive behaviors. Ritualistic behaviors may be related to physical appearance, a clean and tidy environment, illicit substance use, sexual urges, germs and personal hygiene, and/or personal safety. The most common example of obsessive-compulsive disorder is fear or contamination that leads to excessive hand washing. Obsessions and compulsions slow some clients to the point it can take hours to do something. These behaviors are usually aimed at reducing anxiety or preventing a situation from occurring. Some nursing interventions are: allow the client to perform the ritual at first without interfering. Avoid hurrying the client. Identify activities previously enjoyed, and give positive reinforcement for non-ritualistic behaviors. With severe levels of anxiety that develop with obsessive-compulsive reactions, phobias, and panic attacks, the nurse should not interfere with the ritualistic behavior or phobic situation, or try to reason the client out of the situation. The nurse should avoid focusing attention on the situation or talking about it a great deal. With ongoing support and intervention, the nurse can eventually set limits on the client's behavior. Other interventions are focused on maintaining anxiety at a manageable level. Cognitive therapy can help the client understand OCD and how to deal with the obsessive thoughts and compulsive actions. Groups can model ways of coping with anxiety. OCD is not only about obsessions and compulsions. There are other symptoms such as low self-esteem, difficulty expressing positive feelings, depressed mood, judgmental attitude towards self and others, a focus on details with rigid and perfectionist traits, and a tendency to be very productive. Since the client's behavior can be frustrating to both the medical staff and the client's family, power struggles can result. Staff should be clear on goals and outcomes. Consistency is very important, and the client's physical needs should be assessed, as problems can develop related to compulsive hand washing and skin conditions, for example. With post-traumatic stress disorder, the client has experienced or witnessed an unusually traumatic event. The client relives the event through dreams or flashbacks, experiences physiological reactions to cues, and feels distress in reaction to cues that symbolize the event. Nursing interventions include: assess the client's pre-crisis level of functioning, assess the client's use of alcohol or drugs since the event, offer education about ways to cope, and encourage social support. As a nurse, you can assess the client's level of anxiety by asking questions like, "Are you feeling anxious right now?" or "uncomfortable?" Or you can point out the obvious. "I noticed that you're pacing a lot in the halls. Are you feeling anxious?" When the client can take responsibility for the anxiety, you can help him identify situations that cause or increase anxiety. What kinds of situations or stresses increase your anxiety? Or what helped you feel better in the past? Then you can talk about how the client reduced anxiety in the past and the kinds of actions that lowered his anxiety. In general, there are nursing interventions aimed at meeting short-term goals and relieving high levels of anxiety. An important protective intervention is to reassure the client about safety, but without forcing severely anxious clients into situations that they aren't able to handle. The client's coping or defense mechanisms are ways to help him cope with anxious feelings. Then there are environmental interventions, like reducing environmental stimulation, setting limits, and maintaining a quiet and calm manner. Or physical activity and exercise for an emotional release and to direct attention away from anxiety.
Administration of medications is another intervention. The drugs of choice are the benzodiazepines. Some antidepressant medications, such as the selective serotonin reuptake inhibitors, also known as SSRIs, are used to treat anxiety disorders. Medications should also be used with psychosocial interventions, as they help enhance a therapeutic alliance. Common SSRIs include sertraline, Zoloft, fluoxetine, Prozac, and paroxetine, Paxil. These medications are helpful for obsessive-compulsive disorder, panic, agoraphobia, and generalized anxiety disorder. SSRIs are less likely to produce anticholinergic side effects, but they can cause agitation, headaches, and GI discomfort. These medications should not be discontinued abruptly, and they may interact with other medications, so clients should first notify the nurse or physician of any other medications they're taking. The nurse can assess medication effectiveness through the client's increased ability to problem solve and cope with the high levels of anxiety associated with anxiety disorders. These medications are also effective in treating depression.
Education is an important intervention for promoting adaptive responses to anxiety. The client needs to be taught new ways to cope with stress, how to modify behavior, and the benefits of exercise, for example. Consider the following 4 outcomes for anxiety. Which outcomes are most suitable when a client experiences severe panic levels of anxiety? 1. The client will respond to situations with less anxiety? Correct. An important outcome is that the client will experience less anxiety. Number 2. The client will identify and describe feelings of anxiety? Incorrect. Clients with severe or panic levels of anxiety have narrowed perceptual fields with difficulty focusing attention. Number 3. The client will be protected from harm? Correct. Safety must be maintained for clients who experience severe or panic levels of anxiety because the client's judgment will be impaired. Number 4. The client will describe adaptive and maladaptive ways of coping. Incorrect. Clients who experience severe or panic levels of anxiety may be unable to think or function clearly, and in panic levels, experience loss of control. This outcome is better suited for mild to moderate levels of anxiety. Okay, let's look at which of these outcomes are best for clients needing to cope with moderate anxiety levels. The client will identify and describe feelings of anxiety. The client will identify causes of anxiety. The client will describe adaptive and maladaptive ways of coping. All of these statements are true. Clients with mild to moderate levels of anxiety are able to think more clearly and focus their attention. To summarize anxiety disorders, here are some multiple choice questions. Number 1. A client is receiving treatment and an anti-anxiety medication for recurrent severe levels of anxiety. What is the best nursing diagnosis for severe anxiety levels? A. Sensory perceptual alteration. B. Risk for injury. C. Hopelessness. Or D. Risk for violence. The correct answer is A. Perceptual alteration. The best nursing diagnosis is sensory perceptual alteration because the client has narrowed perceptual fields with severe levels of anxiety. Remember the continuum of anxiety: mild to moderate, severe to panic. Number 2. The nurse is teaching a client and his family about obsessive-compulsive disorder. What should the nurse include in the teaching plan? A. Thoughts, images, and impulses can be repressed. B. The family should focus on the symptoms. C. Thoughts and impulses worsen with stress. Or D. This disorder responds little to treatment. The nurse should teach that the thoughts and impulses would worsen with stress, letter C. OCD will respond to medications such as the SSRI, fluvoxamine, or Luvox. SSRIs can be effective in treating anxiety disorders such as OCD. Remember, SSRIs are less likely to produce anticholinergic side effects, but may cause agitation, headaches, and GI discomfort. These medications should not be discontinued abruptly, and they can interact with other medications, so the client should first notify the nurse or physician of any other medications he's taking. Repression, A, is an involuntary defense mechanism, and the client with OCD attempts to suppress or ignore the thoughts